Thanks, Dylan. Cool.
Great, thank you very much.
Could you, when you've gone and closed the door, put a yellow sticky on the door that says recording in progress? Because I don't want anybody coming in and saying, hello, can I just have a word? Thanks, mate.
No worries, nothing at all. Oh, your focus. How do you want to look focus?
Looks fine to me, but I don't have the best eyes. Looks good to me. You tell me. You could see us, so I'm sure it's fine.
It's mainly you don't go back and forth really, but I want the focus is in.
I'm not planning on moving very much.
No, I'll
Right,
thank you. Silent and no, not silent. That wouldn't work.
Could be a new style, silent interview. We could start a trend.
Silent podcast.
Just 20 minutes of not saying anything, and then the credits roll. Right, so it's Johan Jardevall.
That's it.
Right, okay. Sitting comfortably?
Yeah, all good. Yeah.
Johan Jardevall, welcome to Candesking Conversation. Thank you very much for your time today.
Thank you, David. It's exciting to be here.
CEO of Person-Centered Software. Tell us about that group. Tell us about your role.
Yes, so at Person-Centered Software, what we're doing is really focusing on improving care quality in the sector through the software that we develop and deliver for our customers. Our customers are typically care homes, and we focus very much all of our efforts on making sure that the resident outcomes are met through the software that we deliver, through making software really easy to use for carers, care management, seniors, and group management.
So what does it do?
So at the heart of it is the care recording and care management software and daily planning of care and delivering care at the point of care, really. So carers walk around with a device that we supply them with the software on it.
Like a mobile phone? Or?
Yeah, it looks very much like a mobile phone, but it also looks very health care-y. So
yeah.
It's a
dedicated unit.
It's a dedicated unit that you only use for our software. And that then on that device, you get told all you need to know about the resident that you're meeting with, their likes and dislikes, what they need, what the treatments are that they're currently receiving, and also make sure that you have the planned care that's appropriate for that person when you come to them. So you can do the things that you're required to do, and also if you find other things that you need to do when you're there, you can also record them on the device immediately.
So digital care planning and note-taking?
That's part of it, yeah, absolutely, and that is very much at the heart of it.
And medication management as well?
Yes, so we deliver a software for medication management. So as you are meeting your residents as a carer, when you are required to give medication, you do that through our system, ensuring that the chain is unbroken from GP prescription all the way through to administration of medication to the resident in care. And that is to ensure that you give the medication at the right time, the right dose. Of course, it needs to be exactly as the GP prescribed it and nothing else. And also, you don't give the wrong person the wrong medication, for example. So that can typically happen if you don't track it like this.
And you've got other plugins to it. So there's one for workforce management as well?
Yeah, staff, and we call it safe staffing. It's to make sure that you have the right staff in the right place in your care setting at any given time. And it really takes the dependency needs in your care home and then ensures that you can get a mix of staff that is required to manage the needs of those residents at any given time in the different areas of your care.
And what about compliance and reporting and that kind of thing?
So all of those software packages really include a lot of reporting. It does do monthly reporting, for example, that you can use for CQC reporting and also for your own board reporting around compliance. And looking ahead a little bit, what we're also working on now is comprehensive reporting for groups, making sure that they understand what's happening in the different areas of individual care homes, but also looking at what happens in individual care homes and as a group, and how well you comply with regulations in all those groups.
So it's a connected care platform into which there are lots of different plugins.
That's it. Yeah, that's true.
And do owners, investors, managers, whoever, have a dashboard where they can see all of this information?
So they can right now, and all of that information is available to them already in each individual product, and also overlaid in the core product, the digital care planning software. What we're currently developing is a platform called IQ, and it's actually being released right now for general availability. And what it does is give you the ability to benchmark yourself, both your homes within your group, but also against the rest of the care homes in the UK. in
And
Australia.
where does that data for the benchmarking come from?
That comes through your digital care planning system. So it's all the interactions that happen with all care residents at any given time.
And have the homes bought into this idea about anonymously pooling data at any stage, or
Yeah, so it requires them to opt into this. So through the
by choice, or if they use the system, do they have to opt in?
no, they don't have to use. Well, so for using the benchmarking tool, they have to opt in. Otherwise, it won't work for them.
You can't use the benchmarking unless you're prepared to share your data, and if you want to see how you compare, you've got to be part of the group.
That's it.
Got
So,
it.
but you when you sign a contract with us and use our software, you automatically opt in for us storing the data anonymously, and also give them access to their own group's data, of course. If they don't want to be part of the benchmark, they can opt out very easily. So it's something that they do in when they set it up, or if they're an existing customer, they just tell us.
How many people opt out? What kind of percentage?
It's only one customer so far.
Only one. And let's talk about numbers. How many people are using your solutions?
Right now, 8,500 care homes use it.
Wow. Okay. And how many care notes are generated as a result of that?
So we process about 400 million care notes a day. So each individual carer stores about 80 to 90 care interactions per day per resident in the system. And that generates a new about 15, 16 million care notes per day, and we process about 400.
Okay, we'll come on to that vast array of data and what it could be used for shortly. The benefits to the users, I mean, presumably there's a lot less time on paperwork.
Yeah, so initially this was really emotion, and we were the first company in this space in the UK to take care homes from a very antiquated process of paper-based processes to when they planned care and delivered care, where you could see a carer spend their entire day going on shifts, meeting residents and delivering care, and then after the shifts take notes and write down what happened. Of course,
that's fallible, isn't it? That can go wrong.
It definitely did.
Yeah.
And the founders were very clever, and they realized to create adoption here, you need to make it very easy to use. So they created a system that was mobile first, so that it was on a mobile device. It also had an icon-based interface, so that you pressed icons, so you didn't have to type a lot. And there was no real barrier to actually start using it. It was very simple.
You sometimes get pushback with this kind of tech where, and I'm going to generalize, but the older carer might struggle or push back a bit against using this kind of technology. Have you found any kind of resistance?
And at that time, this was 15 years or so, 13 years or so ago, they had a lot of resistance because people were used to a certain way of doing things, and they felt this was surveillance as well.
Sure.
And I've seen lately, I came on board in about 2 years ago, and I still sometimes when I came out and visited customers, there were carers who didn't particularly like having to do this on a digital system, and that was more a misunderstanding. I think they didn't get how this would benefit them. So once you show them that this is actually taking less time out of your day, and this enables you to give better care and more person-centered care, then they typically come on board with it. And when you also show them that it is very, very easy to operate and anyone can really do it, you don't even need to speak English to be able to use it. It's that easy. And what it does is also, it creates a stringency. So all the care notes are taken the same compared to other systems or paper-based systems where you write.
There's a uniformity to it. And when you've got uniformity and you've got data, you can do comparisons, you can see what's working, what's not working, presumably.
That's it.
And that could be used then, presumably, to make better informed decisions.
Yes, and they already use that now as it is. But with the new IQ module that we're coming out with, that's the heart of the benchmarking functionality that we built. It also shows trends, and it shows how you can improve care in certain areas, and also where you're doing really well, so you know what to focus your efforts on. And it also gives you the ability to draw conclusions about things that are going to happen based on this vast data set.
How much access do families get to the data about their loved ones?
It's up to the resident in care and to the care provider to share. And if they have, there is another product that we offer called Families Gateway, and some people know it as ResHub, and it enables residents to communicate with their loved ones outside of the care setting through an app. It also allows the care provider to share care notes and activities notes and other things from our products directly with the family members so that they know what's going on. And it enables them to keep that social connection. One of the things that we found was so important for a healthy stay in a care setting is that you have a social connection with people. Loneliness is really causes a lot of problems for people, and we all know it. If you are lonely for any amount of time, you do deteriorate. And we can typically see that in our data as well. So people who are less lonely and more connected have a better stay in a care setting.
And a longer, happier life, I would imagine.
Absolutely, yes.
You don't do the hardware side of it so much. What about sensors and the other kinds of hardware that are used increasingly in care these days? Does your data communicate with these devices as well?
It does, yeah. So most sensors integrate with us. And there are, of course, always new ones coming out, but most of them communicate with us, and they get data about residents, and they also store data about their interactions with residents in our system. So we get a lot of automated data from these sensors in rooms. One of the most interesting ones is a pain measurement device where in certain cases where people living with dementia have difficulty describing their level of pain, for example, this device can make it easy for them to assess the level of pain someone is in and then deliver appropriate pain relief. So you don't have to have a one-size-fits-all and prescribe too strong pain medication for people if their pain level is low enough to be covered by an ibuprofen or paracetamol, for example. So and that all that data also gets stored in our system so that you can then use it and see how you can improve your care individually.
Sure. You were in robotics, I think, before you came to your current job. I think you said you've been in the current job for 2 years.
Yes.
How do you go from robotics, I think marketing automation, to social care technology? What was the appeal? Why did you make the jump?
Yeah, so I think it requires a little bit of backstory. So I've been in software for my entire career. I've been in software for a very long time. I think the first system I sold was when I was 15, and I built it myself and was quite proud of it. After that, I've been through a lot of change in the software industry, and over the last 10, 12 years or so, it's been a lot of focus on AI. The first one was marketing automation, and marketers have been using AI for a long time in figuring out who is actually looking at the messaging they're sending out, making sure that they adjust it appropriately. And the software I was running, the company delivering, was exactly that. It was personalizing messaging automatically for people based on who they are and their likes and dislikes. And following that, the robotics company was for warehouse automation. The focus was really on taking away those really, really hard jobs in warehouses where you were, as a person, you would pick an item 800 to 1200 times an hour and really physically burn out from it in short order. And the idea was to replace those types of jobs with robots and allow people to do more meaningful
Looking
jobs.
at the data, spotting the problems, using it to sort out solutions. Are you drawing a parallel between what you were doing and where you are now? Or?
Yeah, not really, but I would say the idea there was that we would allow the robots to use AI to be self-sufficient, so they could figure out how to do things themselves. I think the social care sector, when I came in, was nowhere near that. So it had really only recently started going from a paper-based process to a digital process for care planning, and about 40% of the market are still using pen and paper for medication management. In my view, that is terrifying. Because we know how error-prone it is, and you really want to do.
How error-prone is it? I mean, do you know how bad it could be?
We stop every resident in care from getting the wrong medication or the medication at the wrong time every day.
Right, your software.
Our software does.
Because it flags it and says, no, you're doing it wrong.
Yes, exactly that, and we track that.
So I mean, that's a thing to be hugely proud of, but it's also worrying that were it not for you. Okay.
Yes, absolutely.
So, what was the appeal? You could see that there were changes that could be made using the ideas that you'd formulated over the previous career.
That's exactly it. I could see that we're in a digitally underserved category, and that is so important. This is where you're at the most vulnerable when you're a resident in care, and you really need the best possible help you can get. And looking at what was happening in the sector and seeing what software can bring to this, creating the efficiencies needed to. It's quite a strained workforce. I think there is 140,000 vacancies currently in the sector, and clearly, if we can manage to utilize people better and make sure that they spend their time giving care rather than thinking about giving care or doing admin tasks, then you're winning, right? And if you can stop people from getting the wrong medication, stop them from being lonely, or help stop them from being lonely, all of these things do definitely matter.
And I guess that plugs in with the longer term vision for PCS. How does that align with the wider transformation of the social care sector and the direction of travel that you see?
So the way we're hoping to affect the industry is by showcasing how you can deliver better care. We can elevate the entire industry. So that's our aim, really. We're here to make sure that through our software, care providers can deliver better care because they know what great care looks like, and they can assess it and they can do something about it. So all the things that we're building and putting together is really with that in mind. And so our hope is that through doing this, we can create a self-regulating industry where they can show how well they're doing things, and by doing that, they can then get to show how justify the fees that they take. For example, right now there is a lot of debate around quality of care. There is always a terrifying history of abuse cases that has been put out there in news articles,
including very recently. Yes, indeed.
Yeah, and of course that doesn't need to happen. And we believe that with the way that we can elevate the sector, that also gives people a reason to feel proud about working in the sector.
So, and sometimes it's hard to justify the work that you have done or to explain it, but if it's all being recorded, then you have evidence that you have done what you said you've done and why you've had to do it.
Absolutely. And you can showcase it to families and others. So, yeah.
Sure. You've got this wonderfully complex connected care platform integrating all of these separate parts. What's the most complex challenge that you've faced in getting this working? Because I imagine getting it all to work and talk to each other is a heck of a job.
It's quite interesting that it's not really a technical challenge, and you would think that it is a technical challenge. I think it's quite a lot about mindset, really. So getting people to understand how to use this and utilize it is one. The other is
it's the human side of it as much as anything. However simple you make it, there's always going to be a hurdle in informing people how best to deploy what you've created.
That's it. Yeah, absolutely.
So how do you inform them? How do you teach them?
So we have spent a lot of time figuring out how to do onboarding of people right, and talking to the right people, and also give care providers the tools that they need to explain to staff and residents how they should view this, because
there's a sell to be made, isn't there? You've got to sell the idea to them and get their buy-in to what you can do.
In some care settings I've been out, they've actually had to put up signs saying staff aren't on their mobile phones. This is the device that they use to plan care with.
Yeah.
And that's such a simple thing, but actually family members were thinking that people were texting away with their friends rather than giving care when they were interacting with our software, right? So that's just a very easy win for us to make sure that people understand that this is actually the device they use day to day to make sure that they give the right care.
8 million care notes, all of this data. How do you get on with the CQC? What, if anything, are they allowed to look at and see? What could your data in the future be used to do? Because you mentioned a self-regulating industry, which is interesting. Presumably with the right data, you might be able to predict what is good, what is bad, even what a CQC rating might be if you were looking at the amount of trips and falls and feeds and medication errors, etc. You've got the raw data that could spit out a number at the end and say, oh, this is a good place to be, or otherwise.
So we, of course, don't deliver any data directly to the CQC. They're not our customer, and we don't work directly with them. The care providers do, and they're regulating the care providers. And all care providers typically show the system to the CQC when they come and inspect them. So I think it's an important distinction to make. We're not here to police or govern anything. We're here as a software provider, and our customers are the care providers, and we deliver our software and the data to them. and then they can show it to the CQC if they want to showcase aspects of them.
Have the CQC come to you and knocked on your door and said, "This is interesting, how could we use it," or not? Any discussions?
So we talked to them about how it can help um, elevate the way that care providers can interact with the data. We don't talk to them about how they can interact with our data or with the care providers. That's not the way it works. So, for example, very recently they explained that they had some features that they thought would make medication management safer. So they told us them, and we told them where they were on our roadmap or whether they were already in the system. But typically the CQC talks more to the care providers than they talk with us.
Got it. What geographies are you in?
The UK and Australia.
Different regulations, different tech maturity, different care delivery models. How applicable is your system to other jurisdictions? How do you overcome the problems? And are you looking anywhere else?
Last one first, I think. We're not really looking anywhere else right now. There's so much to do in the UK and Australia. In Australia, they're about 7 years ahead of the UK in terms of moving from paper to digital. So they started the journey much earlier. The entire ecosystem there is digital now. There isn't really any paper-based systems left in Australia, which means that we could learn a lot from them and we could accelerate our own delivery in the UK of new features that we know are going to come because they've already happened somewhere else. And in the UK, there is distinction between the different countries as well. So Scotland has slightly different regulations to England and Northern Ireland and Wales. So it's all a little bit different. And the way that we tackle this is by focusing still on the resident in care. That's really at the core, and we focus at making sure that every feature that we deliver should aim to deliver better care. So if we do that, we know that we're going to be compliant everywhere.
Sure. Okay. AI in care, what do you think is the next big thing, the next big step change that might be introduced in the next 5 years, say?
So there's a lot of AI now in the care sector. I think a couple of things I'm a little bit worried about, especially people putting resident data into ChatGPT. That would be terrifying if people did that. And we know that people have done it, and it definitely shouldn't happen.
We know that people have medicated, prescribed, assessed patients on the basis of that happening in some places.
Yeah. And that is, of course, not okay. So what we are seeing is that there are a number of new solutions out there where they create more of a walled garden around AI and make sure that the language model is kept within that walled garden and make sure that resident data doesn't get out anywhere else, and clinical data, of course, shouldn't get out anywhere.
And there's a balance, presumably, between efficiency and empathy when you remove the human element.
Absolutely.
Albeit that the data doesn't lie, but you still want to have that personal connection.
You have to, and I think all of this data should be used in order to facilitate that human connection. Actually, one thing that's quite interesting in Australia is that they have a robot there right now in a startup phase where it wanders the halls of care homes, and then if someone is looking distressed or interacts with it and says, "Oh, I need help" or something, it can go and then it goes and fetches a human and makes sure that there is a connection there, and it stores it, of course, as a care record to make sure that it was known that this person had a problem and needed help.
One thing that I found interesting is with chatbots, the responses that I've seen suggest that the general public is comfortable talking, for example, about mental health to a chatbot.
Yeah.
Sometimes more so than they are to an actual person, and that surprised me.
Yeah.
What kind of feedback are you getting from frontline staff, and is that going into the way in which you were developing the interface or the software going forwards?
We of course get a lot of feedback, and we're out there all the time interacting with them. They typically, if we change things, we typically get told very quickly if they like it or not. so we have functions directly on the device where you can we can contact our support and you can give feedback directly, and that is used. And we have sentiment graphs in the office where we can see how well people like things or dislike them. So that's very useful.
I'm tempted to ask you what the most liked and least liked features are of the software. Is there anything where you went, we didn't realize that would be such a hit? And anything where you thought we rolled that out too soon?
So the worst feature we have is our login. which is interesting, and it keeps being a problem. And it's not really the feature itself, it's because people keep forgetting their passwords. So one thing that we learned very quickly, and it's now turning into one of our most liked features, which is why I like to tell this story. When I joined, actually, the biggest problem we had was between the different systems that we offered, we forced our users to log in for every single thing. So you had to log in for your care planning and then log in for medication management, for dependency staff.
For each separate
for
plugin?
each separate product. And what that led to, of course, was lots of lost logins.
Yes.
So our support was inundated, and we also had a terrible forgotten password function. So all of that combined created a very big headache for our customers. And we got told about it, and we could see it in the sentiment graph. And so we got product to rebuild our forgotten password function, made it a lot easier, and then created single sign-on between different platforms as a high priority, and it's all been rolled out now. The next step was to make sure that we have the same resident data across the different parts of our system, so you don't have to double entry and risk then making mistakes when you enter people's names and other details about them. So that's also making the software a lot easier to use for people. So that would be the worst part of our system turned into a real benefit from using us.
Let me widen the discussion slightly from an investor perspective. Social care tech over the next 5-10 years. Is that an attractive area for an investor to be looking at? And where your particular niche apart, perhaps, where do you think is most interesting? Where do you expect to see the biggest steps?
So I think if anyone is interested in investing in social care tech, it is really in the data aspect of it. There is a lot of data stored and processed in this industry right now. I also believe if you think about the human connection here in our future, this is definitely a growing area. There is a lot of interest for different technology providers to come into the sector through sensor technologies, as we talked about, and other things happening right now. And I think the sector hasn't consolidated at all yet, so there is a lot that can happen still.
So do you have competitors in your field? Is this a competitive area, or do you have first mover advantage?
We have first mover advantage, but we also have competition. So in digital care planning, there are around 17, 18 competitors here in the UK. We are by far the largest of the players, and still fast growing, still the fastest growing of them. And I think the threshold to entry is quite high now. There's a lot of regulation, and you have to comply with a lot of different features to be part of the NHS assured website, where you have to be considered.
Particularly around all the data of the residents. I mean, who owns that data?
The residents themselves, interestingly enough.
And what happens to it? Where does it go? How does it go? Can it go? Because that's a gold mine for sensible planning for the future.
It really has to be managed really, really carefully. So it is private data, it's clinical data, and it really can't go anywhere which shouldn't. So what we've done is design a workflow where resident consent gets stored, and care provider also needs to give consent around using the data in certain ways. And it has to be very clear what the data is being used for and how it's getting stored for each individual resident. And we've taken this exceptionally seriously, otherwise we couldn't be in business.
Sure. Any advice that you'd give to the next generation coming through of health and social care tech gurus? What would you tell your younger self if you were coming into this market now?
First of all, it's quite an exciting industry to be in. When I looked at it from the outside initially, it didn't look that exciting, frankly, because it was way behind what everyone else was doing. What happened now is that the sector can leapfrog because they didn't have to go through all the growing pains that everyone else had to do. Robotics have been working for 40 years at the front line of tech, which means that they've also hit all the pitfalls that you can possibly hit along the way. Social care doesn't have to do that. They can go straight into generative AI from being a paper-based system. They just need to think about what they do when they do that. And I think making sure that they have a legal framework for doing for doing things the right way from the start is really, really important.
Anything that concerns you looking at the next 5 years, the way that tech and advances are going?
I think it is really important now that people really stop and consider where they're putting the data that they have about residents and about the care setting they have. I think this is the biggest challenge right now, that people don't really know what these new technologies do with the data that they get served with. And if you are unlucky, you are going to give your data away to someone who will use it for nefarious purposes, really, and you should be careful about that. I think that's the biggest risk now for the sector, that people are just using ChatGPT for everything, right?
We're coming to the end of our time, but you're not expecting this. I thought I'd have some quick fire questions for you at the end.
Great, thanks.
To be answered in one word or one breath. So, one word colleagues would use to describe your leadership style.
Transparent.
Biggest misconception about social care technology.
Boring.
One tech innovation you think will transform care in the next 5 years?
Predictive algorithms.
Can you remember the best piece of advice you've ever received?
Be clear.
What's more difficult, scaling a startup or transforming an established business?
They're different for different reasons, but transforming is probably the most difficult.
Which metric do you care about most right now?
Engaged residents.
And one thing that you wish investors better understood about the care sector?
The lagging of infrastructure in the sector. Sorry, that wasn't the one word.
Johan, thank you very much for your time. It's much appreciated.
Thank you very much.
And that's a wrap.
Thank you. I hope that was okay.
That was great.